I think we all run into the same challenges, I believe. It's the first thing is that, well, there's just so many, I don't even know where to start. There's just so much resistance from the surrounding, from the medical community, as well as the guidelines. So you're really going up against a lot. And to make things more complicated, we're also going against the vegan movement and the fear of the environment, and so there are many layers of the things that are against us. But I think let's start with the medical institution. What I actually want to say is that the guidelines have changed and they are more open. It's just that people are not aware of it. And therefore, the challenge hasn't changed. Fortunately, actually, there is an opening, and the American Diabetes Association is more open to this, which does actually help. But when I look at my trajectory, the challenge hasn't really gone away. Okay, we have a medical establishment that's very much afraid of the ketogenic diet, starting with the name. The word ketosis evokes some fear in doctors because of the confusion between ketosis and ketoacidosis. And of course, we know that there's a very, very big difference. Ketosis is a state where we want to be in, as ketosis is a wanted state where the body is burning fat for fuel instead of sugar, and this creates ketones, and ketones are molecules that give us energy but are also anti-inflammatory, and are signaling molecules that have a ton of benefits for the brain and for the body as a whole. But doctors are afraid of ketoacidosis, which is what happens when you have uncontrolled production of ketones. And this uncontrolled production causes, because ketones are acidic, they actually can change the pH of the blood and lead to a very an emergency situation. This is something that we would only see in type 1 diabetes, or in very rare cases of type 2 diabetes, when we use this in conjunction with SGLT2 medications. So these are the only two cases where you would see diabetic ketoacidosis. Yet doctors are very afraid of the word keto because of this reason. That's one of the reasons. And the other thing is the association with saturated fat. When people think about eating a ketogenic diet, they think of a lot of saturated fat, and this immediately evokes the idea of clogging arteries. Eating saturated fat, the diet heart hypothesis, which we know has never been proven, which says that eating saturated fat will increase our cholesterol, will lead to clogging our arteries, and therefore heart attacks. And these two things are really what lead to doctors to run away from the ketogenic diet. So it takes a lot of diving in, a lot of reading and understanding why this is not true. And that's not something that any doctor will ever learn in any medical conference. That's the key here.